So as you can see, this is the score which I was talking about. It is the instability severity score of the shoulder. It has around 6 parameters, and based on these 6 parameters, we'll be able to decide whether the patient is liable to go for an arthroscopic shoulder surgery or for an open LaTarJET surgery. We have a score of around maximum. We basically give an individual a score, and if the score is more than 6 points, the patient is liable to go for an open LaTarJET procedure. And if the patient gets a score of less than 6 points, you'll be going for an arthroscopic surgery procedure. As we can see, if the age is more than less than if the age is less than 20 years of age, we give a score of 2, and if it's more than 20 years of age, we give a score of 0. We look at the degree of sports participation, whether it's competitive or non-competitive. We look at the type of sport, whether it is contact sports, non-contact sports. We look at the shoulder hyperlaxity, the hyperabduction being more than 105 degrees, or the what do you say, the external rotation being more than 85 degrees, which indicates shoulder hyperlaxity. We see for any Hill-Sachs lesions. Hill-Sachs lesions are basically depressions in the shoulder head of the humerus. We look for an glenoid contour bone loss. So when you basically accumulate these scores, and if the score seems to be more than 6 points, we do not go for an arthroscopic surgery, but we go for an open surgery. Because a score of more than 6 points has an unacceptable recurrence risk of 70% and should be advised to undergo an open surgery. And acceptable if the score is less than 6%, then we can actually go for an arthroscopic surgery. This was a brief description of the shoulder instability severity score, and based on this score, we can decide whether to go for an open or a closed procedure. I would also like to add one more point here is that the glenoid contour is extremely important in deciding whether we go for a LaTarJET procedure or not. How do we assess the glenoid contour is basically we go for the CT scan. In the CT scan, we see how much bone loss is present in the glenoid, whether it is less than 20% or more than 20%. It is said that if the glenoid bone loss is more than 20 to 25%, it is always better to go for a LaTarJET procedure in order to avoid recurrence or failure of an arthroscopic surgery. So, in order to calculate the glenoid bone loss, we usually see the amount of the articular defect present, and there's a rule on how to calculate this glenoid bone loss. So, usually the radiologist does that job for you by you ordering a CT scan of that shoulder, and so that makes our job easier. I hope this brief description helps us to decide in planning of our surgery. Thank you.